All right, welcome everyone. This is Dr. Clark, the Center for Weight Loss Success. And today on Losing Weight USA, we're going to talk about B vitamins. And kind of B vitamins are often thought of as energy vitamins. They can help with energy. We'll talk about how that actually works, as well as kind of there's B vitamins are one of those things that you can't really overdose on. So taking extra B vitamins is sometimes can be very helpful for people. All right, welcome to Losing Weight USA, real-time answers to your weight loss questions. Some of the latest updates and research, as well as a little bit of expert advice. Gives you direct access not only to me, but you should be receiving the health tips and recipes via the membership portal. And yes, I encourage you, get into the membership portal. We keep adding more and more things in there. Each one of these webinars will last about 30 minutes or so. If you have questions, type them into the chat box as we go along. I'll get to them at the end as time permits, and as you know, we'll typically make time permit. If you think things once we're all done, just give us a yell here at the Center for Weight Loss Success. The email is success@cfwls.com. Phone number 757-873-1880. All right, so we're talking about B vitamins. Let's dive in here. Very good. So B vitamins, helpful or just hoopla? No, I think they are helpful. B vitamins, again, are often referred to as energy vitamins. B vitamins technically are coenzymes. And what they really do is they make our body's energy producing equations run more efficiently. So it's not like the B vitamins themselves give you the energy. It's like, no, the energy is coming from what you have stored already. Yeah, the B vitamins just tend to make that the engine run much more efficiently and effectively. A good analogy I'm going to say is kind of looking at our cars. Okay, fuel. Okay, fuel for the cars basically comes from gasoline. You can think of B vitamins as being the oil in the engine. The car won't work, the engine won't work without the oil in the engine, but the actual fuel is the gasoline that's put in there. So we say that B vitamins give you energy. Technically, they don't give you energy. What they do is they make the energy producing equations run much more efficiently in our bodies. Now, B vitamins are water soluble. And if they're water soluble, if we talk about water soluble vitamins, that's vitamin C and the B vitamins. Okay, so B vitamins are water soluble, and therefore, because they're water soluble, we can't store them for extended periods of time. Fat soluble vitamins we can actually store for quite a long period of time, so that if for a while you didn't have access to any food or didn't have access to the B vitamin, or excuse me, the fat soluble vitamins, you wouldn't be deficient. B vitamins, on the other hand, since they're water soluble, means we can't store them for any long periods of time. And so we need to keep replenishing them, which the best way to do that is actually through food. But then you can also do this through vitamins as well. So you take these vitamins fairly routinely, you eat the food that has these B vitamins in them fairly routinely, and so subsequently then we don't become deficient. And again, since we can't overdose on B vitamins, you can actually take large doses of these and they can only help you. Now, the best food sources for B vitamins typically are animal products, but there's also some in vegetables as well. So meats, nuts, beans, okay, they typically are very high in B vitamins. And then also some colorful vegetables will have extra B vitamins in them as well. All right. So to kind of jump into all this, I have this little cartoon here where you see vitamin C talking to the doctor, and the doctor telling him you have a fear of thiamine, riboflavin, niacin, better known as a vitamin B complex. Okay, not very funny. Anyway, all right, so we're going to go through the different B vitamins and talk about kind of how they can be helpful, what they are, what they do. Okay, there are 8 B vitamins, and we're going to go through them, and then we're going to talk about a couple of things that are kind of like B vitamins that can help us, but technically they aren't actually B vitamins. So vitamin B1 is thiamine. It was the first vitamin that was actually discovered. That's where the B1 came from. Okay, it's first vitamin discovered. Thiamine, very important. Thiamine is something we can become very deficient in relatively quickly. That concept of becoming deficient is very important for someone who has just had surgery, whether it be weight loss surgery or any type of surgery, is that if for around surgery they tend to have a lot of nausea and vomiting, try a hard time staying hydrated, not getting much food in, is that they can be actually become vitamin B, thiamine deficient, B1 deficient. Okay, it's thiamine is very important in carbohydrate metabolism, the breakdown of carbohydrates, but also thyroid function, energy production, nerve function, and enzyme activation. So thiamine is actually used in all kinds of biochemical equations in our body. The deficiency symptoms typically are fatigue, confusion, headaches, forgetfulness. You may get some eye changes, meaning that, gee, I can't see, I'm getting double vision, stumbling, poor coordination, depression, insomnia. If you're eating regular food, it's difficult to become deficient, but this is fairly common in alcoholics, that they're not eating food, they're only drinking, and subsequently then high alcohol use, also really high caffeine use can block some of the utilization of thiamine as well. And so kind of in those instances, they can become, or someone can become thiamine deficient. And the issue with thiamine deficiency is that if it is around for any length of time at all, relatively short, literally over a few weeks, is that you can get permanent neurologic damage. Even if you then resupplement the thiamine, is that someone can actually get permanent neurologic damage from the really low thiamine levels. Okay. Birth control pills block some of the utilization, so that's one of the reasons why certainly we encourage, I encourage just about everybody ought to take a multivitamin. Typically multivitamins got all the vitamins in there. Normal dose of thiamine is 10 to 100 milligrams per day. Most multivitamins have plenty of it in there. Vitamin B2 is riboflavin. Vitamin B2, riboflavin, it also is the reason if you've ever been told that, gee, if you take B vitamins, you just end up peeing it out because people see, hey, there's this change in color in my urine. It's kind of a little brighter yellow, a little bit orangey, but it's fairly bright color. That's the riboflavin. But it actually doesn't mean that you're wasting the vitamin. It means you're utilizing the vitamin because it's actually the breakdown products of the riboflavin that get excreted then through the urine, and you get this bright coloring to the urine itself. But riboflavin is involved in all of your body's energy production. So it's very vital for healthy eyes, your immune function, for tissue healing. It's needed to replenish antioxidants, and it also helps to convert other vitamins to their active form, which we're going to have a short discussion about activated vitamins here in just a couple minutes. The deficiency symptoms, depression, dry skin, light sensitivity, typically the normal dose of riboflavin is about 10 to 100 milligrams a day. And then most of these, you'll also notice that most of the deficiency symptoms tend to go along a similar track, meaning they tend to be involved with nerve function and poor nerve function if you're deficient in some of these vitamins. Vitamin B3 is niacin. Okay, niacin is very important for multiple different chemical equations throughout our body. It's used in at least 40 different chemical reactions. Now, positive effects on cholesterol, okay, so it can help control cholesterol by lowering LDL and raising our HDL. HDL is the good cholesterol, LDL is the bad cholesterol. We want to keep the LDL low, raise the HDL as high as possible. It can also help with lowering triglycerides, which a low-carb diet will also help with too. It's also needed in a proper adrenal function. Adrenal glands are stress hormone glands. So we need those to appropriately respond in stressful situations. Niacin is used in metabolism of all your foods that use carbohydrates, fats, and protein. And deficiency of niacin typically is confusion, depression. Again, these are neurologic type of things, fatigue, weakness, again, neurologic type of things. But you can also get headaches, you can get mouth ulcers, those type of things. So typically, it's hard to get deficient in niacin, not impossible. Typically, you can take great big doses, normal doses, typically 50 milligrams, but you see sometimes up to thousands of milligrams per day. It can help with cholesterol problems. So a lot of people will take extra niacin to help with cholesterol problems. And typically, if you're taking high dose niacin, you may get some skin flushing. Typically, your body will slowly adjust to that skin flush. You may have to start with low dosing and build that up then over time. But now they do actually make a non-flushing niacin, meaning you won't get that skin flushing. Okay. All right, B5. Okay, now you notice we skipped some numbers, and you'll notice that typically the B1 all the way up to B12, but there aren't 12 B vitamins. There's only 8. So we skip a few numbers, and part of the reason was as things were discovered, and they labeled them kind of 1, 2, 3, 4, 5, and all the way up to 12, is that what they've realized over time is that a couple of these things that they considered B vitamins weren't actually B vitamins. And so subsequently they were pulled out. There's actually 8 different B vitamins, but we go 1 to 12. B5 is pantothenic acid. It's Greek. For pantothenic just means for everywhere. That's what the word means, everywhere. It's involved in the metabolism of protein, carbohydrate, and fat, but also aids in immune function, wound healing, fat mobilization, adrenal functions, again, our stress hormones, as well as the formation of vitamin D, which is a fat-soluble vitamin. The deficiency symptoms, again, neurologic, fatigue, burning sensations, depression, muscle cramps, but we also get a couple weird things that go along with pantothenic acid deficiency: an enlarged tongue, and graying hair. I don't think that I have pantothenic acid deficiency, but I have had gray hair since my 20s. Okay, some things that kind of block pantothenic acid, so caffeine, estrogen can, sleeping pills, they can block the utilization of vitamin B5 or pantothenic acid. Typical dose is anywhere from 50 to 250 milligrams a day. Vitamin B6 is pyridoxine. Pyridoxine is also added to certain medications. It's often added to, if you're familiar with, I did a recent webinar on the injectable medications used for weight loss. Now, pyridoxine or B6 is often added to that because it can also help with preventing nausea. And so it can actually help prevent some of the side effects of some of these injectable medications. So it's often added to that too. Pyridoxine works with about 100 different enzymes that are out there. Enzymes help run biochemical kind of equations more efficiently. Okay? As we age, we typically need more of this. Okay? Deficiency symptoms, again, depression, fatigue, insomnia, numbness, weakness. Again, these all have to do with kind of neurologic disorders. This one also, for low pyridoxine, you can get mouth ulcers as well. High doses of this are often used to treat some neurologic disorders. Been shown to help with autism, carpal tunnel syndrome, epilepsy, irritable bowel syndrome, and as well as resistant weight loss. Again, that's one of the other reasons why it's added to the injectable weight loss medications. Pyridoxine is one of the B vitamins. It's actually the only B vitamin that potentially you could overdose on. You'd have to take absolute massive doses of it to do it. And actually it's a genetic abnormality that would allow this. So actually most people cannot overdose on pyridoxine. But there are a few minority of individuals that actually can because they have a genetic abnormality. Now, to get around this, if there was ever any question of, gee, do you have that genetic abnormality, is you can take activated pyridoxine, which is often referred to as P5P, pyridoxine 5-phosphate. You'll often see it in activated vitamins. Pyridoxine 5-phosphate is the activated version of pyridoxine by itself. And activated vitamins, and we'll talk about in a minute, basically means it's in an active form. Your body can utilize it immediately. Typical dose is anywhere from 5 to 500 milligrams a day. Again, there are a lot of people actually take high dose of this because it can help with kind of menstrual cramps, PMS, irritable bowel syndrome, as well as can help with resistant weight loss too. All right, B7. Vitamin B7 is biotin. Okay, biotin, people often hear about, it helps with hair, skin, and nails, and that's very true. It's actually made by the gut flora. So when I had a probiotic discussion in one of these webinars, the gut flora can actually make biotin. So it's probably one of the vitamins that technically we wouldn't, it's hard to become really deficient on because the bacteria along our intestinal tract will actually make some. We can subsequently absorb it from that. Now, that's not very efficient. Typically, it would be better to get it through our food sources, vitamin sources. But it is one of those that is made by the gut flora, and technically it would be somewhat a little harder to get deficient on biotin. It's also involved in the metabolism of protein and fats. It does tend to increase insulin sensitivity, which is kind of there are very few things that really treat insulin resistance, and we would like to be more insulin sensitive, but this potentially can help. Again, it's important for healthy skin, hair, and nails. So we see it often if people are having skin or hair problems post weight loss surgery. Adding extra biotin can actually be helpful. Deficiency symptoms, dermatitis, hair loss, depression, muscle pain, numbness, and tingling. Again, a lot of these symptoms have to do with neurologic issues. And it's because the B vitamins are very important in all nerve function. Typical dose, 300 to 600 micrograms, not milligram, micrograms per day, that people often take very large doses up to like 50 milligrams, which is 1,000 times more than that. All right, vitamin B9. Vitamin B9 is folic acid. Vitamin B9 was the big thing that was, when we think of the March of Dimes. The March of Dimes was in to help prevent spinal cord defects for babies. The women would take extra folic acid to prevent spinal cord defects because that's one of the deficiency of that can make him higher risk to develop spinal cord defects in the baby. So it's very important for energy production as well as your immune system, but the deficiencies can lead to problems in a baby if a mother is deficient during pregnancy. So kind of the March of Dimes was that, kind of raising money to get vitamins for pregnant women to help prevent this problem. Okay. So other things that can occur with folic acid deficiency, depression, you could get loose bowel movements, sore tongue, graying hair again is another one of those, weakness, insomnia, impaired wound healing, numbness and tingling, and then finally spinal defects. That's the big one with there. And again, a lot of these have to do with neurologic problems. What makes people more prone to folic acid deficiency or low folic acid? Alcohol, tobacco, aspirin can, birth control pills can. There are many meds that tend to interact with folic acid and prevent the absorption. And so subsequently then extra folic acid, taking those vitamins is a good idea. Typical dose, 400 micrograms per day. All right, and then up to B12. B12 is kind of the last one, last of the actual B vitamins. It's cobalamin. You'll often see it as cyanocobalamin, or you may see it as methylcobalamin. Methyl is the activated form. Cyano is the unactivated form. So many, B12 products out there, you'll see that. But cobalamin is the, if you want to call it the generic for B12. It's probably the best, B12 is probably the best known and probably the most important B vitamin as well. It's difficult for vegans to get enough because typically animal sources are the best sources of vitamin B12. So it's difficult for vegans to actually get enough B12, and then definitely they ought to be on one multivitamin and potentially extra B vitamins. It's absolutely essential for DNA synthesis, protein synthesis, again, nerve function, but also very important in red blood cell production. So that people that have B12 deficiencies, which are relatively common, B12 deficiency may not make enough red blood cells and they can become anemic. And that's going to be one of B12 deficiency, one of the major causes of anemia. It's also needed for carnitine metabolism. Carnitine is kind of like an amino acid, but it's very important for fat mobilization. Okay? So some people take carnitine supplements. There's some minor evidence that carnitine potentially can help with weight loss as well, because it helps with fat mobilization. Deficiency symptoms: confusion, depression, dizziness, fatigue, insomnia, numbness, tingling, weakness, memory loss. All of these things, again, typically have to do with neurologic problems. Typical normal dose, 400 to 5,000 micrograms per day. Typically, if someone's getting a B vitamin injection, it's usually around a few thousand. It's usually around a milligram, which is typical injection dose, which would be 1,000 micrograms. All right, methionine. I'm going to talk a couple things that are kind of like B vitamins. And I'm talking about methionine, inositol, and choline. And the reason I'm going to talk about that is because we often, for people that are doing injectable B12, we'll often add methionine, inositol, and choline to this little combination. It helps with fat mobilization. That's where it is, can help with weight loss thing. So methionine is actually an amino acid. So it's not actually a vitamin. It's an essential amino acid, and it's used to make protein then. It helps facilitate the breakdown of fat. So again, fat mobilization, and actually helps prevent accumulation of fatty tissue within your liver as well as within the arteries. So methionine is a good thing potentially to add to for fat mobilization. It also helps normalize homocysteine levels. Typical dose is 250 to 2,000 milligrams a day. So this, again, you could take fairly big doses of this, but it is an essential amino acid. Inositol used to be thought it was a B vitamin. It was actually originally called B8. Okay? But it's not a B vitamin. Actually, it's so it is, but it's like a B vitamin. Multiple functions. Helps reduce LDL, which is the bad cholesterol. It has some calming effects. It helps form lecithin. Lecithin is an antioxidant. It also helps with fat and cholesterol metabolism. So again, fat mobilization there. High dose caffeine can actually potentially cause a deficiency. It in itself, inositol, is used to treat depression as well as panic disorders. Typically these, again, I look at they're an extension of neurologic disorders then. Typical dose, 200 milligrams a day. And then choline. Choline is a third part of MIC, methionine, inositol, and choline. Choline is very important in making acetylcholine. Acetylcholine is a neurotransmitter. When it's a neurotransmitter, is basically the little molecules at the end of the nerve cells, at the end of the nerve, as a nerve kind of shoot get this so you're trying to send the message down the nerve. When it gets to the end of the nerve cells, it's this neurotransmitter, the acetylcholine, that makes it move to the next nerve cell. So it's the transmitter that actually affects between nerves then. So it's very important in making this neurotransmitter acetylcholine, which then can help with mobilization of fat and metabolism of fats. It does help lower LDL, and it's absolutely required for normal brain function because it's a neurotransmitter within the brain cells themselves. All right, typical dose 400 to 500 milligrams a day. All right, now I mentioned right at the very beginning of this discussion that I was going to talk a minute about activated vitamins. Activated versus inactive vitamins. Vitamins are typically or normally given in the inactive form. Then, once your body takes them in, so we have to take this vitamin, we have to get it down into the intestinal tract. The intestines then have to absorb it. Then it goes into the bloodstream, which typically passes through the liver. And so then the vitamins can be activated. And your body typically needs to activate the vitamins in order to actually utilize the vitamins. Now, the issue there is that many people may not activate B vitamins very effectively. And if you don't, then taking an inactive form of the vitamin isn't going to help very much. And subsequently then taking an activated form, so that actually all you have to do, you take an activated form of the vitamin, passes from the intestinal tract into the bloodstream, can be utilized immediately. It does not have to be activated. It doesn't have to be taken from the inactive form to the active form. So subsequently activated vitamins typically are used much more efficiently. And if you're one of those individuals that don't activate the B vitamins well, then taking it in an activated form can be very helpful. Activated vitamins typically cost a little bit more. Not a whole lot more. It may be an extra $1 or $2 for a whole bottle, for a few months worth. But activated vitamins typically are just a little more expensive, but they can be extremely helpful though. And they can actually help improve the efficiency of the utilization of the B vitamins. So you get more out of each dose. Pharmacy grade vitamins are often in an active form. We talked previously about pharmacy grade versus just the normal grade vitamins. Pharmacy grade are made under pharmaceutical conditions there. B vitamin injections, I kind of alluded to this earlier, we often give them the B vitamin injection with the MIC, the methionine inositol choline. Typically B vitamin injections are given intramuscularly. And again, they're water soluble, so typically it's not like you can overdose on there. And typically B vitamin injections can be helpful. Unfortunately, there isn't a good way to predict how helpful they'll actually be. And so when people ask me about, gee, can I get B vitamin injections? Would they help me? The answer is maybe. Hopefully yes. Anybody can do B vitamin injections. They're very safe. Okay. It's just that you want to be, whether your result will actually be helpful or not. It's hard to say that without trying it. So I typically see 4 different scenarios when people utilize B vitamin injections. 1, it helps with an energy level. Number 2, it can actually help with weight loss. Number 3 is that, hey, it actually does both. Okay. Number 4 is that, well, I didn't really notice anything. It didn't really do a whole lot for you. Now, it may help you nutritionally, but there isn't that kind of feeling that I get, hey, it's really helping me. So they can be very helpful, but there's no guarantee of that. Why would a B vitamin injection work better or differently than just a pill? Well, I alluded to that kind of in the previous slide. We talked about activated versus inactive vitamins, but this is a different way. When we take any pill in, it's got to pass from the intestinal tract through the liver. Now here, when you do an injection, it's like you're bypassing having to go through the liver, and subsequently then it can be absorbed into the bloodstream, and your body can utilize it kind of immediately without getting potentially deactivated in the liver itself. The liver is also where a lot of things then are inactivated. So we do B vitamin injections here at the office. They do contain B12 as well as the methionine and acetylcholine. If that's something you're curious in, just give the office a call sometime. All right, so in summary, B vitamins are absolutely essential for life. They're usually kind of helpful for most neurologic conditions. So if you have any type of neurologic condition, potentially taking extra B vitamins can be very helpful. They definitely are essential for muscle function, nerve function. They help with fat mobilization, as well as then the proverbial energy production. B vitamins can be obtained from food, and we get them very efficiently and effectively from food. It's just that extra B vitamins potentially can be very helpful for you too. So I do recommend people take them. I think most people benefit from extra, just taking a multivitamin, which will have some B vitamins in there. But then also most people need extra vitamin D. And then once we start getting beyond that, B complex is a pretty good option as well. All right. Don't see much questions out there. If you have questions, though, pick up the phone, send an email, send a text. Join us on our next Losing Weight USA. Remember to get into the membership site. I encourage that all the time. Stop by the office, get your body comp done, log into that membership portal. You should be receiving that weight loss tips as well as the weekly recipes. Tune in each Tuesday, 12:15 for the next webinar. Watch your email for the invite and link. And remember, it's your life. Make it a healthy one. Have a good day, everyone. Take care.